Hello everyone, we are here today to discuss about the delirium. Delirium is a very serious and often overlooked condition where the main characteristics of delirium is acute decline in consciousness as well as cognitive functioning. Even though it is a life-threatening, but still it is considered to be one of the potential reversible disorder, but then it affects both central nervous system, which impacts the various cognitive abilities such as attention, perception, behavior and sleep patterns. And it's very crucial for the healthcare professionals to understand the complexities of this particular disorder, to recognize its symptoms as well as to intervene them. Defining the characteristics of the delirium, the first main characteristics of delirium is impaired consciousness, which is considered to be one of the hallmark symptom of delirium, that is disturbance in the consciousness. And the second symptom is cognitive impairment, that is various functions of cognitive abilities will get declined when the delirium happens to the individual. So, cognitive abilities includes memory, attention, executive abilities. And then the third characteristic is psychiatric symptoms. So, that includes the disturbances in their mood, hallucinations, that is the disturbance in their perceptions like delusions, and some kind of irritability and agitation are the some symptoms that will be seen in the delirium. And then also the disturbances could be seen in neurological manifestations, that is the person who is suffering from delirium will have to exhibit some neurological symptoms, which includes tremors, asterexis, that is flapping tremors, and also involuntary eye movements, coordination, there is very poor coordination among the various movements. When it comes to the epidemiology of delirium, if you could see the various statistics that's been drawn, highest population at risk of developing delirium are intensive, that is ICU patients, those who are admitted to the hospital most likely, and also those who are undergoing the terminally ill, they are also almost 80% of the population are most get into delirium, and other conditions also includes like the elderly peoples and open heart surgery patients. These are also the people who will undergo delirium. And considering the risk factors of delirium, it would include the age, especially with those over 75 years are most likely to develop the delirium. And in consideration of gender, male are the population who are at high risk for delirium compared to any other gender. And also the underlying medical conditions, that is if they are undergoing any medical conditions, then they are also most likely to develop delirium in the future. When it comes to the diagnosis of delirium, there are three major parts that we are supposed to do. The first thing is clinical history. The detailed clinical history of an individual is must in order to diagnose the delirium. That includes medical history, medications, prior episodes in case if there is any, and also the recent changes that had happened in their health status. So, the complete clinical history is the first step that we have to consider. And the second thing is about the physical examination, that is the proper physical examination of an individual has to be taken. That includes neurological assessment or also any other medical condition if they are undergoing, that has to be assessed properly. And then it's about mental status examination, the complete mental status examination, especially the mini mental state examination, which debriefs about their cognitive abilities are must when it comes for the diagnosis of the delirium. And these are all the diagnostic criteria according to ICD-10. In order to diagnose the delirium, these are all the criteria to be met. So, the first thing is about the impairment of consciousness and attention, where the person is less wakeful. And the second criteria is about the global disturbance of the cognition, that is the individual's perceptual ability has to be disturbed, where the person will complain about illusions and hallucinations in them. And then is about impairment of abstract thinking and comprehension. The person will have a very short form of comprehension abilities, and then impairment in the immediate recall as well as recent memory, where it will be disturbed totally, and then disorientation for the time as well as in more severe cases also for the place and person it will get disturbed. And then it comes for the psychomotor disturbances, that is the person either will have hypoactivity or they might exhibit hyperactivity, that is unpredictable shift from one moment to another. These will be the things, as well as there will be the flow of speech disturbances, either it could be increased flow of speech or it can be decreased flow of speech, and there will be the exhibition of sudden shock reactions in an individual. These are all the few things that could be observed with respect to psychomotor disturbances. And then the sleep-wake cycle will also get disturbed, where the person will either have an extreme amount of sleep during the night as well as day, or there will be very lack of sleep, especially in the night, and we could name the condition it as insomnia, where the disturbances in the sleep could be fine, and the person who is undergoing delirium might be very active at night, whereas during the day they might be having a lot of disturbances with respect to their daily functioning. So, this is sleep disturbances we could see, and then at the last it will be about emotional disturbances. Emotional disturbances includes the person might undergo depression, anxiety, fear, irritability, euphoria. Euphoria refers to the extreme happy or extreme mood, and also the lack of interest in any other activities and inability. So, these are all the few criteria that is supposed to be considered. So, it is a very important thing to be notified here. The first criteria is about impairment of consciousness and attention, which is one of the hallmark symptom of delirium, which in fact differentiate delirium from any other organic mental disorder. And the second thing is about global disturbance. Why we call it as global disturbance? Because there will be the disturbance in the different abilities of the cognition, perceptual distortions, hallucinations and illusions, impairment in the abstract thinking, impairment of immediate recall and memory, as well as disorientation for time, and in the very severe cases disorientation towards the place and person. And also the next thing is about the psychomotor disturbances, where an individual will have lot of problems with respect to psychomotor disturbances, and then it is all about the disturbances in the sleep-wake cycle. The person cannot sleep and he will be very active during night compared to any other conditions. And the last is about the emotional disturbances, that is the person will start having shown the very bad disturbances in their mood, where they will not be able to execute their normal emotions normally. So, these are all the very important criteria according to ICD-10 in order to diagnose an individual with delirium. Thank you.